Um, we do have a quorum. So the only thing that we have on the agenda for today, well, I didn't have anybody sign up for public comments, so we'll take a look at agenda item number 3A, review long-term 90-day recommendation as stated in the charter for this joint City of Wausau Marathon County Homelessness Task Force. And one of the things that we would like to discuss today is those 90-day services that we passed a resolution on the last meeting to have Administrator Leonard take a look at incorporating the surrounding communities in that discussion and what that looks like. So as soon as we get some information back from him, we'll have some more data on that. But in the meantime, some of the discussion that we would like to have is those services and the gaps, identifying gaps in existing mental health and substance abuse treatment resources, and what those recommendations might look like for the next meeting. So I would like, if possible, maybe Vicki and Diane take a look at, Beth Ann, take a look at maybe what those service gaps might look like, so we can maybe agendize something for the next meeting and give some direction to Administrator Leonard.
Okay, well, one of the things that we had as a tool for us to review was the report that was done through the opioid settlement funds, which was really that gap and needs analysis. So I think that document is something very valuable to focus on. One of the key areas that results in us having a shortage of therapists and clinicians in our community as a whole, and I would say Wisconsin and probably the whole country, but it focused on Marathon County, was really a geographic map of the lack of people who have the credentials to be therapists and certified substance abuse counselors in Marathon County. So if people saw that, there's an actual chart about that which shows the numbers. It's understandable why we don't have enough people in the field and why various clinics are struggling with recruitment. And so there's various strategies that are in place, such as supporting growing your own with people in training and providing the supervision hours and things to them, like we're doing at North Central Healthcare. But that in and of itself is a huge systems issue that, I'm not sure if it's in the scope of this council or committee to be able to respond to, but that is, again, a systems wide gap. In terms of, other access points, I think in relation to this topic, it may somewhat depend on what this group is going to say is in the purview of what the city and county would be coordinating for us to know what that would look like. So why I'm saying that connection is because obviously North Central Healthcare is considered a county county partner in that we deliver the mental health and behavioral health services for Marathon, Lincoln, and Langley counties, and we receive some funding from those counties to do so, but then also, of course, receive additional state and federal grants as a government organization to provide those services. So I think it will depend on the scope of what any solutions we move forward to say specifically, are there additional services that we would need to provide? So I'm not sure what to say beyond that, beyond the fact that there is a system-wide shortage of providers. I guess that's how I would start it, but.
Sorry, does anybody else have any comments on the shortage of services in the community? Go ahead, Terry.
In addition to shortage of providers, there appears to be a shortage of program types. And I know that there are many people that I have spoken with who have indicated that they want to get into a program, but the process for getting into the program is so difficult and lengthy. And when there are AODA problems or alcohol problems, and someone has the courage to come and say, I need to get into a program, I don't know if there's a process by which that could be expedited, because that feels like something that's of real need here. And I have heard a lot of public response to that and response to that from the unhoused. So I don't know if that's a potential here. And if the county could look at providing a program whereby there would be more immediate services rather than having to go get a referral, go through a medical doctor. And if they walk in and say, hey, I have a serious problem, I need help, can they be helped?
I guess I would have two comments to that. One is, at least in our current system with North Central Healthcare, anyone presenting to our crisis center, which is open 24/7 and available by phone service, can access some type of service. A crisis assessment is a measure of support and then helping people to plan around what services they may be eligible for and how to connect with those inside of our own facility as well as connect with other ones. So we have people who will come and present to North Central Healthcare and share that they are in, what they're going to, they may not use the word crisis, but that they're in some type of a situation where they need immediate help and they may be eligible for and want to go to our adult crisis stabilization facility, for example. And that we have 16 beds. We're very full. And so while that is an answer for a lot of people, we prioritize our Marathon, Lincoln, and Langley County individuals as well. So, but we don't always have all the capacity, especially as of late. We have been very, very full this winter season. So that's an option available. If we're looking at other services such as community treatment and our outpatient services, at least for North Central Healthcare, then there is a referral process and there's some eligibility determinations that have to be made and that type of thing. So that's our current process. What I would say, which I found really interesting last time when we met, is in the La Crosse model, with the focus on how the team would come together, and it would include case managers from the community, not just case management for the comprehensive community services or CCS, although it did include them, but it also included housing case managers and various people like that. So then the person that they are looking to assist would help to determine what it was their plan was and what they needed, and they could access services more quickly that way because there was again, they spent a lot of time making that plan and how that could be accessed. So they were able to remove some of those barriers given the resources that they put into it. So that could be an option of doing something specialized like that. In our current setting, we have more of the traditional model, and obviously we're looking to get people served as quickly as possible, but there is red tape that people have to go through in terms of the medical necessity, insurance, just accessing the appointments, those types of things. So that's accurate. I guess I said there were two things, but my third thing I would actually say is, in our experience, sometimes people will say that they're ready for treatment, and then by the time they come, Craig's nodding his head in his experience, by the time they come and actually meet with somebody and kind of see what that'll entail, they may change their mind, but they aren't necessarily going to share that with other people. So sometimes the perception can be that they were turned down, but really they're not ready to access it. So that third piece is also in play.
And I do understand that, but I think, I have known in my personal life, and I have seen in this community where people say, I want to go into a program, they go to the crisis center and say, I need help. And you talk about eligibility. I know the chief had mentioned to me one time about his enthusiasm about the Rogers Behavioral Center here. And I did some checking on that and talked with several people who were connected with it. And they work with Medicaid, they work with Badger Care, but for those who don't have an income, the cost of that program is significant. It's several $100s a day or $31,000 a month for inpatient. So when you talk about eligibility for these programs, I know that several of the people said that we work very hard to get people into Badger Care, but I'm wondering if the community couldn't have a day when they have an emphasis on, and they advertise, we are going to get you into Badger Care and do everything we can to enhance the eligibility of many of the people. It feels like there would, I don't know if that's possible, but it would seem like a good idea.
I just want to clarify something. When I said eligibility, it may be like a medical eligibility or a diagnosis eligibility. North Central Healthcare provides services when people don't have an ability to pay. Obviously, we would be seeking insurance reimbursement when people have insurance, including Medicaid. But if people have no ability to pay, we have a sliding fee scale and we have charity grants available to pay. So finances should not be an option at North Central Healthcare. Other clinics have different policies in place, but I just want to clarify that wasn't what I was meaning when I said eligibility.
Thank you. Chief Barnes, I think, had something first.
Yeah, I mean, I think I know the answers to these questions, but I think there's people paying attention to this, and part of it, the purpose of this is to educate. So, like, I'll try and dumb it down for myself. If I were a raging alcoholic or drug addict and I went home today and I hit rock bottom and my marriage is going to end if I don't do something to improve things, and I say, I'm going to go get help today, and I arrive at North Central Healthcare, and I say, today's the day I want to go to rehab and I want to be inpatient. Am I going to be inpatient today? Is there a capacity issue within this county for inpatient rehabilitation? And what would be a realistic amount of time, or what would the process be to avail myself of medically monitored treatment? And so that's one example. And then the other might be, one of my staff is dealing with someone out on the street who's intoxicated, heavily intoxicated, and says, I want help. There's a detox component to that, which is separate from rehabilitation. And can you just talk about the capacity of our community in those two lanes?
So detox services is definitely mentioned in the report that I started talking about, that gaps assessment. And that's, I think, as far as I know, that's a need pretty much in every community for some services that can provide medical support while people are detoxing. So that is a need here as well. So we certainly can add that to a list of a gap. So we cannot fill that gap at North Central Healthcare. So to the first question that you have in terms of, is there availability? I mean, it's going to depend on the day. We've been more full in the last couple of months than we have been for a long time, both in our hospital and in our adult crisis stabilization facility. But we do prioritize Marathon, Lincoln, and Langley County residents, of course, and we prioritize people who are at the greatest need. So sometimes we may work with a person to if they are ready for discharge, to help move them to the adult crisis stabilization facility, for example, to free up a bed. So our clinicians are always looking at that to try to fill, but at the end of the day, we're limited in our number of beds. When we look at our medically monitored treatment, Lakeside Recovery, of 16 beds, again, it will depend on the length of time, or not the length of time, but the number of people that are in there. And then generally it's a 28-day program, and it depends on when people are going to discharge and all those types of things. So we do our best in trying to predict when there would be a bed available, but I don't think that the beds are necessarily adequate for the needs in the community. So that certainly is an area of potential growth, if not necessarily for North Central Healthcare, but for another provider as well. There are other providers around the state. So we're one option among many in that arena.
Supervisor Conway?
And another element of that, too, is the least restrictive measures that you have to deal with. Because if you hit rock bottom, you want to come get help, and then a couple days later, well, now I'm deciding I'm going to go drink again, or do whatever. You can't really stop them. So one of the recommendations that I think that we should put forward, it's a couple things. One, remember they talked about the Everyone Has a Name database. If someone comes in for crisis, even if they stay for a couple of days or have a problem or whatever, now you know them. And if they're unhoused, anytime an officer has an interaction, they've been helped at this date. They didn't, whatever it was, they can be tracked. So you can have the resources follow your data. And then, the second part of that is having case management for those folks, because currently you don't track people that are released into homelessness, correct? I think.
We don't track people that are what? I'm sorry.
Released into homelessness. If they don't have an address, you don't have that in your system, do you?
Well, we don't track people, period. Yeah. I mean, I'm not sure in North Central Healthcare, if that's what you're asking. So
yeah. So say someone comes out of the crisis center or whatever, and they want to go back to the woods to smoke crack or whatever. You don't track that. So we don't know how many people are going in and out of services or going into the homeless community.
I would say that's correct.
Yeah. So if we had a system to not only measure that, but also use that for, the warming center or wherever these people might go into the, bounce off the net, you can see where someone is moving through your, through your neighborhood. So you have, people that are up from Point or wherever they get put here. Now you've seen them, they've stopped at Mosinee and they got in trouble for whatever. They stopped here and there and wherever.
I think I would agree with Vicki that that's probably not like a tracking role as I think about the services provided at North Central, but what is absolutely a gap, and if you, like in the La Crosse presentation, they had a lot of different services that they're spinning up, and here's their 5-year plan. The component of that was the most compelling to me was the ability to recognize every single individual with their own story and to be able to track that, not necessarily, they have a name here, and make sure there's not a duplication of services, and we're finding the correct services for this individual. Here is the level of housing that is appropriate for them to be in. And so part of that in knowing everyone would be who's being released from the jail into homelessness, who's being released from the prison system into homelessness, who's being released from rehabilitation into homelessness. So all of that is encompassed in what I found was really compelling, to get those individuals working in that lane to all sit around the table just like we are and be like, how do we help Matt? And do it in an appropriate way that doesn't restrict or endanger the funding sources of any of the service providers that are sitting around the table, or create legal liability for them because of that information sharing. Like, they said it took a lot to be able to do that, but they're doing it. So like, that is absolutely a gap in my lens for this community right now. And like, they had a lot of great programming, but the thing that's helping them move the ball forward that gives me confidence that they can be successful is that, my recollection, it's the City of Eau Claire's employee whose job it is to facilitate these meetings and case collaboration meetings, which I think would encompass exactly what you're talking about.
That's just a better way of putting it. Yes, that's what I meant to say.
Yeah, and I got the same takeaway from that meeting as well, and I recognize that gap that you're all talking about. And I think it was to be able to monitor their well-being, to be able to make sure that they're getting those services and those wraparound services, not just on the housing side, but all the other treatment that they might need to get them out of homelessness into maybe a productive citizen or into a better life. Go ahead.
Yeah, and something that is not just governmental, that, if they're come to him and bounce out, he'll see that they are already at North Central CAP, and they were already at Northern Valley, they're already at the healthcare center, they're already in jail. So you'll be able to get better resources for if, Tracy Rieger decides to, or comes upon Frank, and you know a lot more about him. So it'd be easier to treat them and get them into housing, I would think.
Mm-hmm. And Terry?
As the chief said, he's impressed with the fact that they knew the people individually, knew what their needs were. And I know when Tracy was here, she indicated that they work very hard to get to know the individuals that they work with and know their needs. But in order to do that for our whole population, I remember them talking about not removing them from an encampment unless there would be a criminal complaint, but send them directly to housing so they understand their needs. What do we have to do as a community to get to know the homeless population that well? Do we need surge housing where we can say, hey, we have a place for you so we can get to know you? How do we accomplish getting to know our unhoused population that well?
Sure. Go ahead.
That was a great lead into something I asked our chair to discuss tonight, and you mentioned surge housing. That's a term we heard La Crosse mention. And so how much housing, how much shelter do we need for our population? And I've always struggled to answer that question. One is, having the need to define, well, what is unhoused, and so for the purposes of me sharing information, I'm going to say individuals I would expect to be sleeping outdoors, if not for shelter. And a great time to measure that, in my opinion, is when Community on Call is activated. And that's our system in place when the temperatures get dangerously cold, like 15 degrees below zero or more. And so on Monday night, we were active with Community on Call. We took Wausau Police staff and sent them out between the hours of 8 at night and 1 in the morning, and we checked everywhere we know that homeless individuals might be camping. We checked every stairwell, we checked every parking ramp, we checked every island was walked and looked underneath the bushes, and we found 0 homeless individuals during that period of time, which tells me a couple things. Number one, our Community on Call system is working. And then the measurement component comes, which is, I think, the most accurate measurement we can get is, well, how many people were in shelter? And so on that particular night, my understanding is 37 individuals were at Catholic Charities at the warming center, and that is 7 people over their minimum, but they have a capacity of 40 when it dips below a certain temperature. And then I think there were 9 individuals that were transported in the Community on Call, might have been to you guys, Craig, at Bridge Street Mission. So we're looking at a number, roughly 46 people, and we've been on Community on Call activated several nights in a row now, and that number has been pretty consistent. And my staff report not finding people out at night. So, like, what do we need for a capacity of shelter to be able, that's the question. How big does it need to be? I think if you give yourself a plus or minus, like when they do political polling, plus or minus 5, I would say. So that number's like right around 50 to me. There might have been someone sleeping outdoors, and I think people are more creative and more willing to allow people to stay with them when the temperatures are that cold. But how many people would be sleeping in our parks or in our ramps or outdoors if not for shelter? I'm going to say 45 to 50 people. And so as we look at what is the need for shelter capacity within our community to meet current needs, that's where that number is. And you mentioned surge, like whether that's a surge to spin up from 30 to 50, like that, if that's what La Crosse is intending to do, they didn't want to let the cat out of the bag necessarily right away. But I thought that was very helpful to me to see. Here is a day when nobody's going to want to be outside. We confirmed that we couldn't find anyone outside, and how many people sought shelter. That's probably one of the most accurate numbers that I think is available to us. And tonight or tomorrow night? Tonight is the count. What is it called? Point in time count. Thank you. Where volunteers are going to be out in the community trying to count the number of unhoused individuals. And it wouldn't shock me because we're also still in Community on Call, that you take those activities, and I think it paints the clearest picture we've seen as of late to be able to identify that number of people. Thank you.
I would make the suggestion that to get the most accurate number, you'd want to do something similar like that in the summer, because we've just found that I think you alluded to it, they get a little more creative and sometimes repair some relationships or behave better. So in the worst weather, and we know of some that are out of the city at other programming, but wouldn't be surprised if we see them again in the summer. So I would probably guess that the capacity number would have to be more like a 75 for year round. But you're absolutely right. With Community on Call, we would have been able to house anyone who reported for shelter in the last 3 nights between the overflow and the other. The people we didn't shelter were the 7 cars in the Walmart parking lot that didn't come in for Community on Call. Now, that's Rib Mountain, so we're not policing that, but those for mostly Wausau people that drove because they've been allowed to do that.
So, and just one additional piece of information that I think is a gap that I don't have any suggestion for how to fix. we have 3 or 4 individuals that, based on their behavior, are not really eligible or appropriate for either the community on call sheltering system or they're trespassed from the CPC for good reason. Like, they put at risk the entire population of individuals staying there. So then the question that was posed to me today, and I just probably had a dumb look on my face and said, I don't know, is what do we do for them or with them, especially when the temperatures are incredibly dangerous? And I don't have a good solution to that, but that's a gap. So what about the population of individuals who none of our shelter services are appropriate for them? What's the alternative?
Is that a behavior thing that they can't be sheltered or some other factor?
Yeah, I mean, it is a result of their behavior. Some of their behavior, I would suggest, is a result of their addiction, their use of alcohol and drugs, and or mental health condition that they're a danger to everyone else, or their behavior is so belligerent and disruptive that it's no longer appropriate for them to stay there. So,
Okay.
And I think that's a county problem because we're supposed to be responsible for AODA and mental health, issues. So that to me says crisis center. And if they want to try to leave when it's 15 below out, they're a danger to themselves or others, then you can have them committed.
so
I know is more trouble than,
yeah, I mean, that is if you ask the average officer how do they want to look at the problem, they say, are they a harm to themselves or others? I deem, yes, you are. And so now we're going to take their freedom away for up to 72 hours while they're evaluated or receive treatment. But it is not that simple. So these individuals are not, we could ask them if they'd like to voluntarily go. I know what the answer is. No. And they don't meet the legal criteria for an officer to sign a Chapter 51 detention. So, it would be great if that's the solution, but I don't think it is because they maintain their rights. And when we hear the words criminalize homelessness, in one particular case, one of the individuals who they had no place left to be. Craig, I mean, you know what I'm talking about because you're like, I know they're going to be a problem, but we will do our best. We're familiar with this person, and we gave them a shot at being in the overflow at Bridge Street Mission. And then they were nothing but disruptive and belligerent and intoxicated. And so where did they shelter? What did they do? Well, their behavior and their intoxication was a violation of either their bond conditions or their probation. And so they got arrested. And taking people to jail in that situation is never our goal as the solution. But when it's 20 degrees below zero and the option is outside in the elements or in the jail, I was happy that probable cause existed for them to be taken into custody and taken to the jail. So, like I said, there's a lot of things that could be, and they would require changes in the law in order for, that scenario that you described, for us to see the Chapter 51 process be the solution.
What is Chapter 51? What's the criteria to apply it?
So there's two statutes that law enforcement officers can utilize that allow us to take someone's freedom away. And one is the Chapter 51.15, 5115, and that allows us, to the point Supervisor Conway made, if someone is a harm to themselves or others, that has to be the case. So, but there's a lot of nuance to that once they're evaluated to be deemed appropriate. So it is for individuals who are mentally ill and suicidal. So they're oftentimes it's people that are trying to harm themselves, but it's also for individuals who are a danger or harm to others. Like, you could be suicidal or homicidal, and that has to be not just a behavioral thing. It has to be a mental health related. Boy, I'm butchering this, I think, but you're nodding, Vicki, so it must be making some sense. So we could spend 5 hours talking about all the different challenges and the roadblocks in the 5115 process, emergency detention. 5115 is emergency detention. There's also Chapter 5145, which is an individual who is intoxicated or inebriated to a degree that renders them, there's a word, and I feel old now because I can't think of it, incapacitated. So what does incapacitated mean? And there's a definition for that. Frequently, when our officers deal with someone who's unconscious, doesn't know what day of the week it is, they're so intoxicated, we have the ability to take them into custody, but then we take them, their first stop is the hospital. And by the time the hospital is ready to release them, they're no longer incapacitated because we're only allowed to keep them in custody for while they are a harm to themselves or others or while they are still incapacitated. Intoxicated is not the barrier. It's not just that anybody that's intoxicated that can occur with. It's people that are incapacitated due to intoxication. So those are the two statutes that we utilize as law enforcement. It's always in conjunction with the Crisis Center in North Central. But there are lots of barriers and gaps in the ability to deliver those services to an individual.
Thank you. Vicki?
I think just bringing it back to the bigger picture, because once we start talking about this really difficult population that we're trying to figure out, like what could be the options for them, and we've mentioned some of the barriers, and I remember in the lacrosse presentation, they talked about that as well, and my recollection was when they looked at the population that they have, that they said it was less than 10%, if I'm remembering the number right, that probably fit in that population, and those are the ones that probably were going to have a solution at the end of their 5-year, that they were moving forward, right, with people that I'm not going to say, well, maybe had less barriers, we're more ready, all those things. So they're making incremental progress as they're going. So I don't want us to lose sight on that and, get bogged down in that we need to have a solution for everybody all at the same time, because I think that's impossible to do. So that's why I really like their 5-year plan approach. And I think that's why it's also difficult to talk beyond the big picture issues when we're talking about mental health and substance use treatment, availability and gaps. I think it's hard to be more specific than know that we have a lack of clinicians and programming and potentially beds, is because we're not exactly sure what that population also needs. And part of that is, and that's one reason why I have enjoyed listening to the lacrosse progress, is because they've been there, how they've evaluated everything is that there needs to be a housing option first, and then work with the person on what level of treatment they need or will be willing to do. And what the director of their Health and Human Services said really quite clearly was that they found that all partners didn't necessarily all know what was available, even in the current structure, and or the current availability of services. And that's why I'm saying I think it's difficult for us to be more specific on gaps until we know what we are trying to solve and for what population and in what way. Because to me, it goes back to the original question still is, what is the city and county's role of government in solving this? And La Crosse obviously took it on. It looks like Eau Claire is going to be doing some work in it. And I think that's what, to me, I feel like we have to answer that question and then look at how we're going to approach that before we can be more specific on what gaps we want to address in mental health and substance use. At least that's how I see it.
Yeah, I agree with Vicki, and I took that away from their presentation as well. I'd like to do a short recap for right now on some of the notes that I've been taking about some of the gaps in services. One of the things that we talked about was the shortage of clinicians and be able to address the gaps in those services. And Terry said that the shortage of programs, but I think right now, like Vicki was saying, the shortage, do we really have a shortage of programs, or is it just a shortage of clinicians to run those programs? And it sounds like we do have some expedited services that are available. I'm not sure if everybody takes advantage of those, but the 16 beds that are full that Vicki had mentioned, is there a waiting list for folks that want to come in and use those services?
For our adult hospital, there's no waiting list because people would have an immediate need, and then if they need hospitalization, we would be referring out to a different hospital. In adult crisis stabilization, also, there's no waiting list, and so we would try to help people find another alternative, and potentially, again, for example, with the informal support, and then if we thought somebody was discharging tomorrow, maybe we will be able to have you use that for tomorrow. So it really can't be a waiting list because it's very quick time, yes. In terms of our Lakeside Recovery 28-day treatment, we don't have a waiting list. We have a list of people who are interested in coming to the treatment center for a variety of those reasons, and they're then going through that process of making sure that that they are vetted for that. So again, it's not a waiting list per se, but we would know when we know that we can predict we have a bed available, we know which people we're going to be contacting to say we're going to be ready for you, if that helps.
Okay,
We don't
yeah,
have to call it a
absolutely.
waiting list.
Okay. And then I have on here that I heard need for detox services. I think, yeah, across the board, just a detox service that people can.
And perhaps for a variety of substances too, not just alcohol.
Okay. And the name database, I think that was an important one that La Crosse had mentioned, being able to develop that name database so they can at least monitor where those folks are in their programs, or if they, run across them several times. And then I think that one of the big ones that I took away is the case management side of things for the homeless population. And Tracy does a great job at what she does, but she's only one person. And if we have over 200 homeless in Marathon County, not just the ones that are maybe sleeping on the street or someplace, but other homeless folks, we don't really have a way to manage their cases right now without them going into a voluntary program or something. That's the takeaway that I had. And I don't know, Craig or Diane, I don't know if you have any experience on any case management for the folks that you guys might see and how you do that.
I have two pretty informal case managers at our outreach center. And what I say that they have other responsibilities, but their passion is to help these people get into better situations. And they were able to do that in 90 cases last year. So they've done well. But in our on-track campaign, when we expand our outreach center, which hopefully will be done in May, in that plan there is a specific position that we want to add a community navigator, which is the term the Housing Task Force is using for that case manager. And so we'll have a dedicated person to pick that up. And then that space is also going to be available for others in the community. So like Tracy knows if she wants to come meet clients there, which she often does at Community Partners Campus right now, but that'd be another place that she can meet. And other agencies can meet with people. That's kind of in that vision. And we hope to have that up and operating in May. Funding and construction pending.
Oh, awesome.
As we do
yeah,
that.
that's great.
So that we do have plans to really add that. And I think there's room, though, if we're going to really have enough that other agencies could do that as well. And I know Neighbors Place has done some things with case management. Now they're specifically focusing people who are non-housed, who are not unhoused, but I know they've served some people who've been unhoused. And Community Partners Campus actually is adding someone to work with Tara, because Tara's been pretty much serving as a case manager in a lot of ways, and I know they have plans to add someone there. So I think that vision of these community navigators throughout the different agencies is kind of growing. So that should fill some of those voids.
Yeah, I like that. And part of our 90-day plan was the support from nonprofits and faith-based organization, report on services provided. And I think the case management side of things is important. We heard that at the cross presentation, and we know that through Tracy as well, that's the important aspect of getting the wraparound services that are available in the housing that these folks need. Go ahead, Diane.
We have
At North Central Community Action Program, we have 3 case managers. One of those case managers is Chandra, who works with our PSH, people who are chronically homeless. I did write for an expansion of our PSH program, and on last Friday, I was notified from HUD that I did get that expansion, so I'll be hiring another case manager to help in that program. But also, our agency does wraparound services for people who aren't homeless. That's the majority of our folks in our housing programs. So indeed, wraparound services are important, and proper case management is huge, and properly trained people are necessary. So when I wrote for my expansion, I wrote for a substance abuse counselor to be hired by my agency so that I can have them go multiple times to these chronically homeless people each day, because we can't make them take services to stay in our housing program. But I feel like when they're ready, I mean, if somebody's on their doorstep once or twice a day, maybe that will be more helpful to those folks. We can also help others who are not in that program with this counselor. So I'm hoping I can find a substance abuse counselor. I did send one of my case managers, Ted Merwin. He's in our Marshfield office. He actually went through his programming, and he's trying to find a place in our Central Healthcare. He's applied to do his in training. So he will be a substance abuse counselor when he gets his training completed. But you have to find a place that has people doing the counseling. So
Yeah, that's great. It's really nice to hear that you have those services available and that you're using those. And I think it's important for the county and the city, and I know the city already has Tracy working on those kind of things, but I think it's important for the county to get on board with, what that program looks like and how we can support that. And then how much shelter do we need, right? And it sounds like, with your community and call program, you're checking. And it sounds like that we do have available space for folks to go in severe weather or, whatever they need.
Yeah, I just want to reinforce my opinion, which might be slightly different than La Crosse's plan, which is I think a holistic, strategic 5-year plan is incredibly important. I think that makes sense to me and a direction that this community should go. But in the meantime, we still need to be able to treat a symptom, which is, to me, when I think about that, that's the sheltering. We don't not have shelter while we wait to come up with a plan that's going to include shelter, because in the course of doing that, we're going to have all these individuals that are sleeping outdoors. So when I'm investing time into what does this look like moving forward, I think there's a point to bring everyone together, to get this collaboration, to have a strategy. But in the meantime, we still need a place 365 days a year to put a roof over someone's head. So to me, that's the low-hanging fruit that needs to be picked first. But I agree with your point there. Thank you.
Thank you. And then, I made a note of the community on call, about 45 to 50 people that you were talking about, Chief Barnes. And you're doing is it called central count? Point in time count. Okay. Point in time count tonight? Okay. And then Craig mentioned we should also do that in the summer as well. Or you do it in summer? Okay.
Or Wednesday of every January.
Okay.
We always have 37 people in Marathon County, and I'm sure we don't get them all, but there's always at least that many
Okay.
on the streets because shelters are generally empty.
Okay. Might want to. Sorry.
So the shelters are generally empty in the summer. I mean, there's a few people that stay there, but we'll find at least 37 people throughout the city, Marathon County. It's
Okay.
typical in the summertime.
But you also have HUD requirements. You have to ask them questions. They have to answer it.
Oh, yeah.
Things like that. So it's
Yep.
it's still not it's more than what we count.
Oh, for sure. For sure.
So I would just beg to differ a little bit or add some context to our shelters are rarely at, our 30-bed shelter is rarely at capacity like this last summer, but it was more than 50% full. We saw average daily capacities in the 18 to 25. Like we were never hitting 30. There was never anyone being turned away, but there were still a lot of individuals seeking shelter, even when we're enjoying a Wisconsin summer.
Okay, thank you. And I did note that there are typically around 3 or 4 people not eligible for the community on call or shelter scenario. And I know if Craig is working with those folks too and trying to figure that out, that's a gap. It might be a small gap, but it's still a gap. The one that I noted here is the affordable housing side of things, and I know La Crosse was working on different options on what that looks like, and maybe with the task that we gave Lance on the 90-day plan was, I'll bring these to the table and say, maybe in the next meeting we can take a look at those gaps and come up with an action plan and some discussion and possible action on those gaps and what that looks like.
I see Chairman Gibbs here. Would making a list of like county-owned properties that would be suitable for that kind of housing be something that we could do?
Yeah, and I think part of it is, and I've had this discussion with Administrator Leonard as well, is, for this task force, we can make recommendations on what that county-city collaboration looks like, and have Lance and his team and the city come up with that plan, that 5-year plan or the short-term plan, and what that looks like, and then bring it back to the task force and let us know what that looks like.
Yeah, and maybe there isn't anything, but I would have to think that there are solutions better than the one that went through Wausau and went like that with the, so I think
Sure.
that'd be beneficial.
Sure. That's what I have for today. Does anybody else have anything that they'd like to discuss on the 90-day plan? Go ahead, Bethan.
I get a little nostalgic because I sat in these rooms a lot, and I've written 3 plans since I've been in this city. I've been here about 17 or 18 years, and these plans don't go anywhere. And people get really upset, that we sat down and we worked out a plan. And I think that the reason that the plan is working in La Crosse is because of the county employee and the city employee and their responsibility for ongoing collaboration and continuation. And I can tell you, I wrote a plan, the last plan we wrote, I think was 7 or 8 years ago at the United Way, the plan to end homelessness. It was a 10-year plan. It would be going on right now. It has all of these items. It has all of the same items that we're talking about today. It talks about case management. It talks about shelter. It talks about the need for more AODA services. It talks about a detox center. It talks about expanding the detox center that was once the Salvation Army gym, which is where we took people back in the day when they couldn't go anywhere. And they would sit in the gym with the big, scary case manager until they detoxed or it was morning. And I think that really is the big reason that their plan is going to be successful or is showing success, are those 2 employees and the accountability to continue the work. And so it makes me very nervous when you're like, we're just going to send it over to the county and they're going to write a 5-year plan and then we're going to come like that. I think we need to be very specific about the implementation of the plan or the responsibility for implementation. Because as a leader at a nonprofit, and I don't want to speak for Diane, I have a mission to do this thing, and I keep doing this one thing. And the homeless population is very important to my organization and serving them in this one way. But when I get together with Diane, she can only do this one thing over here too. And so none of us can be the convener or the coordinator of the plan. We'd all love to be. And at different times, we've all tried to step up and be that person. But if it's not residing with somebody whose job it is to make sure that it happens and is accountable, and, accountable to the board or accountable to the council to also, report out, we're going to be sitting in this room again in 7 or 8 years, and we're not going to have a lot of success to talk about because we're going to be writing another 5-year, 7-year plan. So I really am very hopeful, because we saw lacrosse and we saw that, and that's very exciting. And I'm very hopeful because the city and the county took this step to create the task force, that I think it could be successful. But I wanted them to know that I think that the success lies in putting the dollars behind a person. And I know that that's not wildly popular these days, to say that I want a county employee or a city employee, somebody else on the payroll. But if we want to make some headway in this problem, in resolving this community issue, it does take personnel.
I'll just second everything you said, and what my takeaway, like what popped into my head as you were speaking, because I sat through some of those, and I thought, are we meeting to meet? You're right. It included all this. It identified the gaps. There's other organizations and groups that are getting together. They're identifying the exact same gaps. But those gaps take dollars in order to fill. And none of those previous plans had any public commitment of dollars. I just remember an individual saying to me, as I'm like, well, here's what we need to do. And they were representing the city. And they said, well, our role as the city is to impact policy. Like if they need zoning changes to be able to do these things, like all of the solutions that were palatable to elected officials at that time cost $0. It just took some time. And so I would agree with you that in order for this to be able to experiment with things, try things, fail, go back to the drawing board and start over again, it requires a commitment in funding for the resources, and it requires a commitment that creates sustainable people in those roles that I agree with you can be held accountable. If we don't have that, everyone's still going to stay in their lane. And then when something doesn't happen, like we need more case managers. Well, that's not in my lane. So we go back to our lane or go back to our homes, and we're like, well, that didn't work. And we end up, playing Groundhog Day.
Yes, and I would like to third that because you said that way better than I tried to in the beginning when I was trying to say that I felt like the city and county needed to define their role before we could have more detail on what we were recommending because of that exact piece. And, the term that they used in lacrosse was that they're the backbone agencies, right? So they're going to make sure that all the partners are convening together and that the resources are there. They're not delivering it all, and they were very clear on what they were delivering and what they were not delivering. And I think that does absolutely have to be defined before we can have a comprehensive plan.
And so as one of these nonprofits that have to stay in their lane, my funding depends on me staying in my lane, and Matt knows this, and you certainly know this. We have to follow those like housing first rules to the letter because we get monitored every year, and they're tight rules for a reason. But that said, we obviously can be a resource, to this case conferencing that we want to do, and we did get the no name or the by name ROI it's called. So, I think we're moving in the right direction.
Yeah, thank you. And thank you, Beth Ann, for laying that out like that, because I think that's pretty much, in my view, that's what this task force is committed to do. And I think that's the direction that we need to head as well. And I don't know what those plans look like in the past, or, if it was just everybody working in a silo and not, looking at the big picture and not collaborating. I don't know. But I think with the direction that I'm seeing with this task force, I think we can make it work. And I think that, our job on this task force is to direct the city and the county on our recommendations for moving forward with a plan like you just described. So, I think the other portion was that, and we've heard it at public comment as well, is the affordable housing side of things and how that looks. So that has to come into play with this whole program. And I think, once we hear back from Administrator Leonard on the resolution that we passed at the last meeting, we might have some better direction on where to go. So that's all I have for today. I'd like to bring some items to the table for next meeting, and we'll get those sent out and then published. Next meeting is February 5th here in the courthouse, so it got changed from the City Hall to here. So they moved, I believe, the HHS meeting to accommodate us. That's all I have. Do I have a motion to adjourn? Supervisor Conway, motion, second by Diane. All in favor? Opposed? We are adjourned. Thank you.